Are we live?
We're live.
Well, welcome to, I can take this off. I don't know where we went.
I am not.
It says that we are live, but we see the camera.
Okay, not saying. Okay, not saying.
Where's our camera, Brandon?
Okay.
I think we have this issue every time. Okay. Live, but we got to
Okay, not saying. Okay, not saying.
Where's our camera? All right. I think we're ready to get started. We are not very technologically capable of too much, but I think that we are live and I think that you can hear us. Welcome to our town hall. If you can't hear us or if you have any trouble hearing us, please let us know in the comments. We have Sally Fair on the other side of the room who is monitoring the comments, and she will let us know if there's any problems. And also, if you have any questions throughout the town hall, please email those or comment those as well, and Sally will be keeping track of all the questions. We did get a few questions ahead of time, and we will try to answer those as we can. And I'm going to give you a little bit of an update here on what's going on at Fairview Haven. So as many of you are well aware, we did have a resident who tested positive over the weekend. The test was conducted on Friday, and we received the results yesterday, Sunday afternoon. Immediately, we did set up our COVID unit, and that resident has been moved to our COVID unit. So to date, as far as our COVID status, we've also had 3 additional employees test positive yesterday. So we've had 12 employees test positive. 6 of them were not in contact with any residents. They were not in the building. So we don't have to worry about them, but the other 6 residents were in the building. Currently, there is only 1 employee that has an active COVID case that was in the building with our residents. The other 2 that tested positive yesterday have not been in the building. So the resident has been moved. We have notified and isolated, as well as retested any resident that was in direct contact with the resident that tested positive. And so thus far, that resident, any resident that was in close contact has been tested and tested negative. But they are isolated and a family has been notified. So if you have not been notified that your loved one was in close contact, then we have not determined them to be in close contact with the resident that tested positive. Also, with this positive test, we have reverted back to phase 1 of our reopening plan. We were in phase 3, as you might be aware. We have reverted back to phase 1, and I'm going to go over kind of what that means to you today, so that you're aware of what changes with that. First of all, I'm going to talk about the residents and what will change for them. As of yesterday afternoon, we have encouraged all residents to quarantine to their rooms. That's throughout the entire campus. So I should go back. Any active cases of COVID, the resident and any staff that's currently active have been strictly assigned to Fairview Haven. There has been no COVID activity in our Serenity Villa building. There's been no COVID activity in our assisted living or in our independent living buildings. Of course, the assisted living and independent living are connected. We have encouraged all residents to quarantine. That's Sally. She's just as technologically stupid as we are, I guess. Anyway, so no COVID at Serenity Villa. There had the Fairview Estates, the assisted living and Fairview Suites, the independent living. They are connected. We do share staff, but at this point there is no activity in those units as well. And so as of yesterday afternoon, all residents have been quarantined to their rooms. That's all buildings, including Serenity Villa. Because Serenity Villa is part of our campus, we treat it just like all the like the building here. So everybody is quarantined to their rooms. Assisted living and independent living residents have been asked to not come over to Fairview Haven for the time being until we get on top of this and we have no more residents testing positive. They're being asked if they do come out of their rooms to wear a mask at all times and to, of course, maintain 6 foot of social distancing. All in-person group activities have been canceled until further notice. We will still do activities over the intercom, such as Reminisce with Rick and Bible meditation, things of that nature we'll still do over the intercom. Team members are encouraged to support our residents through one-on-one interactions, so we will be doing that as much as possible. Unfortunately, under phase 1, the beauty shop does have to close. It can reopen under phase 2, so if we can go 14 days with no new positives, we can reopen the beauty shop. But at this point, the beauty shop has to be closed under phase 1. As far as the trips, medically necessary trips that's the only thing that's going to be allowed under phase 1. So the trip has to be medically necessary. Our nurses will be in contact with anybody that has appointments scheduled. They'll be in contact with the physician to see if it's a medically necessary trip. And if it is deemed a medically necessary trip, then we will carry that out. We will go back to the phase 1 transportation guidelines, which basically state in the nursing home, because it is, remember that the nursing home and assisted living are governed by two different, or oversaw by 2 different government agencies. And so there are just some differences in how we can do things. But in the nursing home, there will be only Fairview Haven employees transporting residents to any appointments that they go to, with some very minor exceptions to that, such as somebody has dialysis or something like that they're going out every day for. And then in assisted living, we will still be able to allow the primary healthcare power of attorney to transport the residents there, and independent living as well. As far as what we're doing for testing, we will continue to follow our testing policy with one exception. We are going to test all the residents again tomorrow, and we are going to do the rapid test on them tomorrow to see if there is anybody else. It will be 4 days, I believe, since this resident tested positive, and so it's our belief that's a good time frame to see if anybody else, if it's spread to any other residents. And so we will be testing tomorrow morning all residents with the rapid test.
It'll also be 3 days before our scheduled testing, which is Friday, and
Right.
You're supposed to test 3 days apart, 3 to 7.
3 to 7 is what
3 to 7
the
days.
regulations say when there's an outbreak. So we'll be testing tomorrow, and then we'll be testing again Friday as normal. And all staffing will be tested on Friday again, Thursday and Friday, like they have been. As far as communal dining, we did have to suspend communal dining, and so all the residents will be eating in their rooms again unless they need assistance or monitoring or anything like that. In that situation, they will be allowed to go to the dining room for that. Residents that do go out to the dining room will be required to, of course, sit socially distanced, which they were doing anyway, but we'll make sure that that is happening. As far as visitors, indoor visits have to be canceled. That includes, we're allowing spouses to come into the rooms. That has to be suspended at this time. All outdoor visits are going to be suspended because residents are currently quarantined to their rooms, so we don't really want them to be out with outdoor visits as well. So basically, we're back to square one, where window visits, virtual visits, FaceTime, etc. are really the best and most encourageable way to visit. Of course, there is compassionate care situations, and we will monitor that. If you feel like that your loved one would qualify for that, let us know. We can assess that. We also do have the visiting parlors, and we're very thankful to announce that the Serenity Villa one has been completed, and that is opening up tomorrow. And so if you have a loved one at Serenity Villa, you can call the receptionist and you can schedule the visiting parlor. The visiting parlors are completely separate from the residents, so there's a glass wall in the middle of the shed, the parlor. So the family will be in one side and the resident on the other side. There's a speaker system. It's heated, so it's very comfortable. So if that's something that you would be interested in, that is something that we can do even under the quarantine and under phase one. As far as the Fairview Haven parlor, that should be opening up the end of this week. We're hoping either Friday or Saturday to be able to start scheduling visits there. So if that's something you're interested in, you can also call the receptionist. And In the past, we've had Serenity Villa families contact the Serenity Villa to set up any visits. We are changing that. So you will be calling Fairview Haven's main receptionist desk to set up any visit, and then they will arrange it appropriately. The visiting parlors will be wiped down after every visit, so they will be safe as far as COVID goes. And again, no mask will be required in the parlor. We do ask that you wear a mask when you come in to screen, and when you go in, you do need to screen before the visit. But in the parlor, you are welcome to remove your mask because, again, there will be no contact whatsoever with any resident. I think that covers the visiting. As far as staffing, what we're doing with that, just so you are aware, we have developed our COVID unit that was set up last night. We will have designated staff in the COVID unit. Right now, we just have one nurse stationed back there 24 hours a day. And they will not be out in the main building of Fairview Haven. It's a completely separated unit. It's plastic wall. Air exchange has all been shut off. We do have reverse air machines in the rooms to pump the air out of the room. I don't know how those work, so if you want some technical details on that, you'll have to ask Jeremiah Rinkenberger. Maybe Brandon knows, but I don't. But there is no air exchange between the rooms and the main part of the building. And there'll be no transferring of staff. So the staff that is in the COVID unit will be in the COVID unit only. And staff in the main building will not go into the COVID unit. We will take stuff to the door, notify the staff that it's there, and they'll go out and pick it up. So meals will be delivered to the door, and then the staff from the COVID unit will pick it up and take it into the resident. We also are stopping any transfer of staff between Serenity Villa and Fairview Haven at this time until we're on top of the outbreak. That's just to make sure that if anybody here at Fairview Haven happens to be carrying the virus, we wouldn't go and infect Serenity Villa. Any employee that will have direct contact with residents will be wearing a face shield as well as the mask. And that's basically, again, to prevent the spread. Now that we potentially could have it in the building with the residents, we feel like that's a safe practice that we need to be following. And so all employees will be wearing face shields at all times when they have contact with the residents. And then, of course, the team members will continue to be tested according to our policy as it's been done the last several weeks. Just one other note that I have here is all entrances to Fairview Haven will continue to be locked. Of course, we have no visitors other than if you're using the visiting parlor, you'll have to come in and screen. Just so you understand, if there's no receptionist at the building, we will be locking the front door now. And that's just, there's been some people coming in and we're just going to lock it, and you ring the doorbell and then somebody will come and assist you and get you screened in. I think that all of the questions that I have received have been answered in what I just said, but please continue to ask them in the comments, and Sally will hopefully be back to help us with those. And then Brandon has a few things he's going to address. He had some questions to answer as well.
Okay, so I received a number of questions via email. And I think Dave covered quite a bit of it, but I'm going to go through each one and add my own piece here. Will the residents be confined in their rooms for meals? Yes. Unfortunately, we have to go back to that since mealtime is one of the most, the most social aspects of their day. They will have to stay in their rooms for meals, with the exception of residents who need assistance eating or monitoring. They will be out in the dining room, which they will be spread out, and the staff members will be assisting them, which is also what we had done before reopening communal dining. Will the residents be quarantined in their rooms? For right now, we are keeping everyone in their rooms as much as possible. Again, with the exception of the people that come out to the dining room to eat with assistance. We are keeping them in their rooms because hopefully if we do have more residents who have yet to test positive, we are hoping to keep that to a bare minimum. The COVID unit, which hall is the COVID unit on? It is on the end of Daffodil Drive. The reason we chose that part of the building is the last 4 rooms on Daffodil Drive are an addition to the original structure, and therefore they have their own air supply. There's each room down there, the last 4 rooms, each one has its own air unit in the attic. We are able to seal off any sort of air return to the rest of the building, and the room that has the resident in it right now, it has one of the air scrubbers, as Dave was mentioning, and that system is just kind of like it's kind of hard to describe. It's like a big box that has a big fan, and it pulls the air in the direction of that box, runs it through a series of filters, and then it exchanges it outside. So basically, it's not a true negative pressure room like you would see at the hospital for like a TB, like a tuberculosis patient or something like that. But it will basically create negative pressure and pull the air out of the unit, rather than letting any of it get back into, or even just float around in the unit. It's pretty much the best way to kind of just pull any particles out of the air, that kind of thing. So that's just a little not very technical description of that piece of equipment that we're using, but it should, even with sealing off everything, all the air returns, anything that could take air back to the rest of the facility, should have been sufficient, but just as an extra precaution, we have that running in there as well. Will anything additional be done to protect those residents with underlying conditions? I would say that it would be, I guess I would classify every resident that we have as someone with underlying conditions. Everyone that lives here has got quite a few comorbidities, so we're doing everything we can to protect all of our residents.
That's the purpose of the quarantine.
Right, which is why we're keeping them in the rooms. And then, as Dave covered, outside people such as the barber and hairstylist are again not going to be coming in for a little while. Let's see, other questions here. Are any steps being taken to identify residents who may have been in contact with a resident tested positive? Yes. Anyone that we feel would have been in close contact, we did a rapid test on, and so far everybody's been negative, but we're keeping a close eye on them. One person in particular is under some isolation just in case. We're isolating one additional resident just because of the level of contact that they would have had. But everyone else, we're just monitoring, and obviously as Dave mentioned, we're testing tomorrow, which leads me to the next question. Will there be more frequent testing to ensure no additional cases are identified? Yes, we will be testing tomorrow with the rapid test, and Friday with the staff and the residents as well, just like we would have done anyways. And the reason we're using the rapid test tomorrow is because we have them available. We would like to get on top of this more quickly than waiting for, test them and then waiting 2 days. That way we'll find out tomorrow if there's any additional cases. And we could get into a pretty lengthy discussion on, are tests accurate? Is this a false positive? Are you using the PCR, the POC? The tests are what they are. I mean, you're not going to find a single lab test that's 100% accurate ever. So I think we're doing the best. I mean, the tests are pretty good for how long they've had to develop them, and honestly, we have to go with what we have, and if we, there's been countless questions since yesterday afternoon. How do you know it's not a false positive? It'd be great if it was. It would be really awesome if it was a false positive. It doesn't really matter. We're going to treat it like it is a positive, because why not? The test said it was positive, so therefore we'll treat it like a positive. If it's a false positive, that's awesome. No one else will get it from her, so from that resident. So that would be great, but we can't live our life assuming that, what if it's a false positive, because you have to use what you have, which in our case, that's the test. And if you can't trust the test, then what's the point? So we're treating it like a positive. We will be, testing all the other residents as well. We're praying and hoping that we don't have any more positives, and we'll just go from there. That's where we're at right now. And then as far as, PCR, POC, I think those those acronyms for different types of tests kind of get thrown out a lot. The health department says the PCR test is the gold standard. That's the one that takes 2 days to come back. The POC test, which is the rapid test, that's the one that we're going to be using tomorrow. It is not the gold standard like the PCR is. The PCR is much more sensitive. However, the POC is cleared and it is approved for use for testing. So we'll be using that because of the benefit of finding out immediately tomorrow.
In our experience with the POC is that it has been fairly accurate.
It has been, yeah. We have had good success. We're using, up until now, the POC test has been used because of the lack of availability of the POC tests. We have to order them. They come in. We didn't have enough to do the whole facility before. We were able to get another shipment in recently of tests. We've been using the PCR test for our weekly tests simply because they are the gold standard. And because we didn't have a supply of POC tests every week to do 260 rapid tests every single week. But we did get an additional several boxes of the rapid tests, and we will be using those tomorrow. We feel like it's justified to use up that many tests of our rapid supply. But up until now, what we've been using the rapid test for, sorry, that got kind of really jumbled there, but up until now, what we've been using the rapid test for is employees. If they have any of this, when they're screening in, if they have any of the symptoms, maybe it's allergies or cold, just to rule that out. Because if, in the fall, everybody's got allergies. So if everybody stayed home for 2 weeks because they had a runny nose or a slightly sore throat from sinus drainage, that kind of thing, we wouldn't have any staff because everybody's got a symptom of COVID just by being alive. So we're using it for that, to rule out any, make sure we don't let people come into the building that have COVID. We've identified a couple staff members with our rapid test, and they have tested. They've come in, they've tested with the rapid test, and then tested positive and not worked. So it's been a huge blessing to have that, and a huge benefit. A nice tool to have in our little arsenal here, I guess. So anyways, but as far as widespread testing, tomorrow will be the first time that we use the rapid test for that. And let's see, what are the safety or infection control procedures that will be followed as the staff moves between the isolation area and the rest of the facility? Dave covered that. So the isolation area we have, it's walled off. There's a pre-built wall that was installed yesterday. It's sealed. Like I said, the air seal, everything like that. The staff are not going to be going from one unit to the other. They're not going to be working one unit and then the next day working the regular nursing home. The people bringing stuff in and out, it should be left at the door, and then the staff will kind of reach out and pull it in. And then, so there shouldn't be very much crossover at all. But also that the hallway there, I guess if you imagine the resident room would be a hot zone, the hallway would be a warm zone, and then anything outside of the unit would be a cold zone. So even dropping something off is pretty low risk because the resident in the unit is still in their room. And then, have you been able to identify through contact tracing or other means how the individual may have come in contact with the virus? That is a little bit of a stumper.
There are some reasons or some situations that we can't say for sure how the person contracted the virus, but we definitely have a couple of suspicious things that we're looking into. So it's definitely something we're considering and looking at, yes. We have to do that because if it's something, that we need to, if there's a practice that was not followed or something like that, we need to get on top of it. But at this point, we are not aware of why this person would have contracted it, but there is a couple of avenues that we're going down.
And it's probably not really possible to ever know for sure.
Right. In this case, for sure.
Yeah. And then I just had two other ones that were a screenshot of a text sent to me. I'm just going to go over. Actually, one of them I already answered with when talking about the testing. The other one is basically supplements, vitamins, that kind of thing. So vitamin D, are the residents on vitamin D to supplement their immune system. When we were kind of getting into all this, and vitamin D kind of came out as a possible theoretical beneficial factor in immune response to COVID. We did have all of our physicians. I sent something to the physicians with a list of their residents who were not already on a vitamin D supplement, and basically left it up to them. Several residents were, you can't just dose vitamin D. Typically, you have to get a vitamin D level. Many of our residents had that lab done and then were dosed appropriately. So, yes, the vitamin D piece was looked at, and several residents were started on a vitamin D supplement for that. I don't know if it's, I don't know how important the vitamin D is, but we did address it when it became a potential benefit. So that's where we're at with that.
So I've gotten a few questions that have come in through the comments here. Do residents know about the positive test? And yes, the residents are aware. We announced that yesterday afternoon when we quarantined them and let them know that we had a positive resident as well as 3 more positive staff. So we make that announcement every week, what the test results were, and keep them up to date. And I think they appreciate that. Are we quarantining packages again? The answer to that is no. You can still deliver your packages to the front foyer there, and the receptionist is picking them up and then delivering them to the residents. The reason we are not doing that any longer is because CDC does not necessarily recommend that any longer. There is theory out there that it's not really spread through what do you call that? Contact on surfaces. It's more aerosolizing and through breathing and stuff like that. What is the plan to relocate residents if COVID unit needs to expand? So the plan for the COVID unit is that we have room for 10 residents. Currently, the way it is structured, we would have room for 6 residents, but we can expand to 2 more rooms before we would get into a situation where we would have a problem with air exchange between the COVID unit and the main building. We can, however, have at least 10 residents in the COVID unit that we have designed. So that is our plan. As far as residents moving into the COVID unit, they will be moved into there if they are under investigation, meaning that we have strong suspicion that they have COVID, if they have symptoms and they're being tested, stuff like that. I believe is the policy. I have to review that actually. Maybe we changed that. But at any rate, if they're positive, they're immediately moved into the COVID unit. Will PT continue since the PT room is blocked off? And that's a very good question. Yes, the PT room is blocked off. The PT room currently is sealed off from the COVID unit and can be accessed through assisted living. And so our therapy department is continuing to operate out of that room. No resident is going to the therapy room because all therapy is being done in their rooms as opposed to the therapy room. But they, as far as supplies and things like that, they're still able to access the therapy room. If the COVID unit needs to expand, that is part of the plan to use the therapy room. And if that is the case, then we will move all of the therapy supplies out of there into the activity room, since the activity room is also not being used. But hopefully this is the last positive that we have and we won't have to do that. But there is plans for that. PT will continue. That is allowed under phase 1 quarantine. And so, but it will be done in their room rather than in the PT room. Can you clarify visits in the visiting parlors? Can scheduling be done during the quarantine? And yes, you can utilize the visiting parlors during quarantine. And the reason for that is because, again, visiting in the visiting parlor is just like a window visit, except for everybody gets to be indoors in the warm parlor. There is a glass wall between the resident and the family, and a speaker system between the two units between the two rooms, so you can hear your resident and the resident can hear you. Again, it's just like a window visit, so there's no reason why you can't come and have a visit in the visiting parlor. Again, we don't have the Serenity Villa. You can start scheduling as of tomorrow. The Fairview Haven visiting parlor, we don't have a date yet as to when we can schedule those, but we're hoping by Friday or Saturday to have that visiting parlor open. And as soon as we have the final date, we will post that on Facebook, and we'll maybe even send out a calling post message to the families. And just as a note on the calling post messages, make sure if you're the family member that's getting those calling post messages to forward those messages on to your family so that they're aware of what's happening as well. Sometimes it's hard to communicate everything, and we don't put everything on Facebook. We do try to keep that updated as much as possible. The other thing is on our website, fairviewhaven.org, we do now have a COVID-19 page, and we will try to keep that up to date as to what we're doing, what phase we're in, what's allowed for visits. The COVID policy was just posted out there on Tuesday, I believe, of last week, but then actually on Wednesday, we got new guidance from the state of Illinois, which basically I have to rewrite the whole policy. So the policy that's out there is outdated. It needs to be updated, and I'll try to get that done this week. Other than that, I think, is there any other questions, Sally? No more questions coming in? I did get a text here. I want to just read that and make sure that there wasn't something I needed to cover there. Oh, you got any more questions?
No. So this is certainly not what we had in mind when we scheduled this town hall.
No, it was supposed to be a really encouraging one.
Yeah. Well, it is. It can be encouraging.
It can be.
It's going well. It's going really well. And you know what? Yesterday, I was very impressed with how calmly the team handled everything. Like I was kind of anticipating walking into a little bit of a firestorm, but I walked into a very smooth situation, and I'm very thankful for the team we have here. It has been a very interesting experience, nothing like what I expected to happen when we had our positive case. So I'm thankful, and I think it's going to continue to go well. It may get harder if we have more residents, or if we start losing staff members from getting it, or anything like that. But so far so good, and I'm really just thankful for how smoothly it went yesterday, getting everything set up and transitions. So lots of good teamwork going on here, and we'll continue to do our best to protect your loved ones.
I would agree with that. I came in right away when I heard about the positive to get things rolling, and it was maybe 10 minutes into it. I didn't know what to do because everybody else was just kicking into action, and the walls were getting built, and the residents were getting moved around, and residents were getting isolated and tested and everything else. And I just kind of sat back in amazement to watch everybody just kick in. We are blessed with our staff here at Fairview Haven, and I know you all know that, but if you have an opportunity, if you know staff members that work here, pat them on the back. Well, don't pat them on the back. You can't have physical contact right now, but maybe verbally pat them on the back and let them know they're doing a great job, because they really are, and without them, we would be a mess. So we truly are blessed, and thank God for that too. And thank you for your prayers. I can tell you they were felt yesterday. I told Brandon that I was just shocked at how I was able to respond to the news that we had our first positive resident. I thought I would go into panic mode, but I didn't. God really provided a peace and a calm throughout the whole facility. So keep those prayers up. That's what keeps us going. That's what keeping us safe. And the resident is, I think I said this, she is still asymptomatic she does have maybe some minor symptoms, but nothing that's unusual actually for this person, and but doing really good. And we just hope and pray. Brandon mentioned the possibility of false positive, and we'd love to say it's a false positive. We're not going to say that, because we have to treat it as a positive no matter what, and we're going to continue to mitigate the risk of anybody else getting it. So thank you again for your support and your prayers. Sally, any more questions? Last chance.
Nope.
If you have any questions, you're welcome to put them on the comments section. Sally will watch that for a couple days. Otherwise, you can message. I should take this off so you can see my lips. You can message us on Facebook. You can email us anytime. We do still have that Gmail address out there, or you can just email us directly, Brandon or myself. It's our first initial last name at fairviewhaven.org. And of course, you can always call. Please understand that, when you call, I know last night the nurses got a lot of calls, and I think they tried to answer them if they could, but if we're busy and we can't answer the phone right away, please don't take that as we're trying to ignore you or we don't want to answer your questions. Keep trying us, or give us an email or a shout out on Facebook, or however you want to do it. We've got one more question. Oh no, it's not a question, it's an instruction. She said to tell you that the meeting will be posted on YouTube if there are any other families that want to watch it. Or it will also be on our Facebook page here. It'll stay on here. But Sally will put that on our YouTube page as well. Thank you again. Thank you for your trust with your loved ones. We love them just as, well, maybe not just as much as you, but I think we love them pretty much. And we're thankful for the opportunity to serve them. So thank you.